Bismillah ar-Rahman ar-Rahim. My dear students of Ajman University, today we're gonna continue with solutions, part 2. In part 2 solutions, we're gonna talk about how to express concentrations for solutions, and then we'll take examples of solutions that are administered orally. Okay, to start with, solutions or the concentrations of solutions can be expressed in different ways. There are many ways to express concentrations, and you should be familiar with these ways. What you have in this table is a few of those ways that will allow you to express the concentration in a solution, in a given solution. So let's talk about these examples and then give you some examples maybe of other ways to express concentrations. Okay, what you see here first, you might be given a number as a percentage W ala V. I will give you an example. For example, let's say I said 2% W by V. What does that mean? Okay, it means, see, this is weight, there is 2 gram, there is 2 grams. See, always when you say 2%, it means grams. Okay, if it is weight, it's gram, not milligram, not kilogram, it's a gram when I give you the number or the concentration as 2%. So it's 2 gram in 100 volume of solution. In 100 volume, what is this volume? It's ml. So 2 gram in 100 ml solution. So what is this 100 ml? It's actually the vehicle or the solvent plus the material that is dissolved in the vehicle or in the solvent. So 2 gram present in 100 ml of solution. So this 100 ml is not only the vehicle but the vehicle with the solute, making 100 ml. So this is the expression of the first one. Before I move to the second one, etc., you need to know that sometimes I may not give you W by V. I just tell you 2%. For example, I tell you the concentration of sodium chloride in water or in a solution is 2%. And I know I'm talking about sodium chloride, which is a solid, and solution is a liquid. I know this. That's why it will be automatically W by V, even though I'm not mentioning that. Okay? طيب, sometimes someone might ask me, okay, give us another example where it's V, for example, by V, volume by volume. Okay, for example, if I tell you hydroalcoholic solution, يعني alcohol mixed with water, okay, and I tell you this hydroalcoholic solution, the content of alcohol is 49%. If you remember, this is the approximate concentration of alcohol in diluted alcohol. Okay, in this case you have 49 ml in 100 ml of the solution. Okay, طيب, I may not tell you V by V, but you should know that because alcohol is a liquid and water or the solution is also a liquid. So that's why if I don't put it, you should know it's V by V. Okay, طيب. But if I'm mixing, for example, solid with solid, for example, I tell you I'm mixing, just for the argument, I'm mixing sodium citrate or sodium chloride with sucrose or glucose, okay? And this mixture is a solid mixture, okay? and I tell you the concentration of sodium chloride in the mixture with the sugar is 2%, and I may not give you the V by V or W by W, etc. So you should know, because I'm talking about solid with solid, okay, and this mixture is a solid mixture, then I know it's W by W. And what it means, there is 2 gram of sodium chloride in 100 gram of the mixture. Okay. طيب. So if I don't give you, you should normally be able to tell, but if I give you, then you stick to what I give you, even though it might not be what you expect. Okay, so if I give you V by V, it means you stick to that. If I don't give you, you should start predicting or thinking what it could be. طيب, there are other ways, for example, as a ratio. Okay, and here you have to be careful. Sometimes I will put the ratio 1 to 2, and that's it. In this case, it will be like one part of this compound A طبعا, and two parts مقابل two parts of compound or substance B. Now B can be solid, liquid, etc., and A also can be solid, liquid. In any way, the units here, for example, can be gram with gram. So 1 gram from A to 2 grams from B. Okay, but if for this ratio, as you see here, I put W على V, now it becomes totally different. Okay, because in this case, if I say 1 to 2 W by V, then in this case it means 1 gram. Okay, 1 gram in ايش 2 ml بصير. Okay, 1 gram in 2 ml. This is how it becomes. So 1 gram in 2 ml. So if it is 1 to 1000, it will be 1 gram in 1000 ml. If it is 1 to 100, okay. طيب. Now, what is this 100? Is it the other compound B, or is it the mixture? No, in this case, when I say W by V, since I added it, then it means the mixture, the preparation. The 1000 is not only the compound B, but it's A and B together. Okay, you got it? But if I don't do W by V or V by V or WW, and I just say 1 to 2, then it's very simple. It's one part of A with two parts of B. طيب. Similarly, if I say 1 to 100 V by V, then it means it's 1 ml, okay, of the compound or the solute. It's 1 ml dissolved in in 100 ml of the preparation. Okay, this is how this is translated. Similarly, if I say 1 to 100 W by W, then it's 1 gram of the solute or constituent in a mixture of 100 grams, because it's W. Okay. طيب, there are other ways for you to know. We have, for example, milligram percent. Okay. For example, I tell you it's 2 milligram percent. See, because I used milligram percent, then I will not say 2 gram in 100 ml solution. No, I will say 2 milligram in 100 ml solution when I write it as W by V. Okay, it will be 2 milligram because I mentioned here milligram. If I don't mention milligram, it will be 2 gram in 100 ml solution. Okay. طيب. Now, what you need to do is how solutions are prepared. Normally, or most of the solutions are prepared by simple mixing of the solutes with the solvent. This is how most of the solutions are prepared. Okay, now uh, we can classify solutions as solutions for oral administration. Okay, so it's a solution for oral administration, and solution for topical or external applications. Okay, so oral solutions or for oral administration, and preparations or solutions for external applications or topical application. Now, for oral solution, we need to be familiar with the constituents of oral liquids, because in many cases they will contain flavorants. Flavors طبعا this is desirable in order to make the medicine more attractive, okay, to the patient. They flavor it, for example, with lime, with orange flavors, etc. Also, for the same purpose, to make it attractive, they may color it. They may also add stabilizers. Stabilizer here means that you don't want deterioration to happen during the storage. طب شو deterioration that can happen؟ ممكن يصير for example oxidation للsolutions. Oxidation will make changes, chemical reactions طبعا. Crystallization يعني the compound or the solute in the solution is crystallizing out, maybe because of high concentration. In this case, I need a solubilizer to stabilize the solute. And of course, preservative, you may need it in order to prevent the contamination. Okay? طيب, these are frequently encountered in oral solutions. Also, you should be aware and you should prevent actually adding components in a vehicle where reaction can happen. Okay, so you don't want to add two components, for example, weak acidic substance and weak basic substance. You add it in a vehicle and then an interaction happens between them. Also, you should be aware of the typical doses. When I'm talking about liquid solutions, usually they will tell you 1 teaspoonful or 2 teaspoonful, or they will tell you, for example, 1 tablespoonful. And you should be familiar with these terms and what do they mean. طبعا in pharmacy, when we say 1 teaspoonful, we refer to to 5 ml, a measurement of 5 ml. When we say 2 teaspoonful, we are talking about 10 ml. طبعا teaspoon, because you know the teaspoon is smaller than the tablespoon, the one that you eat rice, etc. with. Now the tablespoonful is 15 ml. Okay, so you should be aware of that. طبعا, of course, we prefer not to use teaspoon or tablespoon. We prefer to use a calibrated container in order to measure these volumes. That's why in many cases, when you buy the solution bottle, what do you find? You find that the cap is calibrated, okay, and this will allow you to measure a specific volume from this solution. طيب, now we will talk about the examples of oral solutions. The first thing we will talk about اللي هو dry mixtures for solution. إذن the product will be a dry powder or a dry mixture. It's solid. This is the product. But when you want to use it, when you are going to use this dry mixture, you have to, بين قوسين, between brackets, reconstitute this powder. يعني add to it the solvent, the proper solvent, with a certain volume, or up to certain volume, shake it and make sure that the material dissolved, and then it becomes solution for consumptions. Now, why this is done? Why the solution is not ready? Okay, it's better that it's ready because in this case we can guarantee that the manufacturer is using the right water, the right volume, etc. So why this is not available as ready to use solutions? Why is it a dry mixture? The answer for this is one, that the dry powder, once it is reconstituted, it's made into solution, the expiry date will become very short. Okay, and a typical example اللي هي cephalosporins, like we have the penicillins and cephalosporins examples, and these are antibiotic. You go to the pharmacy, you buy a bottle with containing dry powder, and then you add to it the water to a certain mark on the bottle. So antibiotics are typical example, but sometimes they also use powder, because powder will occupy smaller volume in the pharmacy. Okay, sometimes if you can rely on the customer to add the water, in this case you can sell him sachets, and then he can go home, put it in a glass of water, in a cup, and then add to it water to reconstitute the powder, and then drink the solution. So in this case, maybe it's not the stability that really is the concern, but maybe the volume. If the pharmacy already have it as ready to use solution, then it will occupy a bigger space in the pharmacy. Okay, this can be another reason. Many antibiotics, okay, when they are reconstituted into a liquid form, into a solution, they will have from 7 to 14 days expiry date. طيب, now what should happen? Actually, on the product's label, it should be mentioned the expiry date for the dry mixture and the expiry date for what? For the reconstituted powder into solution. So both expiry date should be mentioned. طيب, this dry mixture, like for the case of antibiotic, okay, what does it contain? Does it contain only the antibiotic? No, it will contain all the components of the formulation, which includes the flavors, any coloring agent, buffers, etc. Just the only difference is that water is not added, and it's added only when it's prepared. It's preferable that the pharmacist prepare this, but actually most of the time you will do this at home. Make sure you use good water for that purpose. طيب, طبعا examples, as I said, penicillins, cephalosporins, derivatives, they are good examples for that. Now we talked about dry mixture. Okay, we're talking about dry powders or granules. Now we are talking about solutions, يعني already made liquids. Examples of that include oral rehydration solutions, or sometimes they call it oral rehydration salts. طبعا here it can be in the form of dry mixture or ready. Okay, so it can be both actually. The dry, the reason for the dry is for the product to not occupy large space in the pharmacy. Okay, but you can also find it as ready to use solutions. I think you already, not I think, I know that you already had this preparation in your previous course, Elul Pharmaceutics 1, and I think you had to prepare the oral rehydration solutions, or at least have a discussion regarding it, okay, and what you should uh, advise the patient with regards to using oral rehydration solutions. Now, what are they used for? Before we talk about that, طبعا the condition is diarrhea. And what is diarrhea? Diarrhea is a normal physiological body response. And this happens normally when your body is trying to get rid of toxic things like rotavirus or E. coli. Okay, it's trying to get rid of that. How does it get rid of that? By diarrhea. Diarrhea causes these microorganisms or these pathogenic entities to get out from the body. So logically you should not stop that. طبعا many people, they take, what do? They take lopramide or some other drugs in order to try and stop diarrhea. But actually the best approach is not to try and terminate it too quickly, but rather the best approach is to try and replenish or replace the lost fluids and electrolytes from diarrhea. Okay, and طبعا this is more dangerous for infants to lose fluid and electrolytes than adults. In all ways, it's very important to replace the fluid and electrolyte, but it's more dangerous in infants. طيب, what is the basic or the concept behind oral rehydration solutions? Now, what you will expect if you eat or drink anything, you expect that diarrhea will not allow anything to be absorbed. So how come this will be absorbed? How come the electrolytes will replace the lost fluid and electrolytes? Well, now I will explain this. In our GIT, especially the small intestine, glucose is absorbed actively. Yani there is an active absorption, not passive. Okay, not because you have high concentration gets absorbed. Even if the concentration is small, the glucose gets absorbed into the blood. Okay, and this absorption is an active process. Okay, even when diarrhea is there is an active absorption of glucose. طبعا this is important because when you lose a lot of your GIT is not absorbing the nutrients, and you are losing electrolytes, you might go into shock and hypotension, and you become very weak. Now glucose will be important to give you energy, right? طيب, now in this process where glucose is absorbed actively, sodium will be required. Okay, يعني the nature of this active absorption is that sodium must go with glucose. And if sodium goes with glucose, sodium is a cation, then you cannot have only cation going from one side to another. You will need an anion absorption. So automatically you will have sodium, for example, let's say for the argument, sodium citrate or sodium chloride getting absorbed. If sodium chloride gets absorbed, then water must accompany that. You cannot have sodium chloride getting absorbed without water being absorbed. So what's gonna happen? So in this case, glucose, sodium, cation, and an anion. The anion can be chloride, can be citrate, can be bicarbonate, will be absorbed, and because of that, water is going to be absorbed, and this will circumvent or short circuit dehydration. Okay, طبعا sodium, or they may add also potassium, they like to add it with bicarbonate or citrate because usually in diarrhea you have the blood is little acidic, okay, because of metabolic acidosis, and bicarbonate and citrate compounds, they alkaline or alkalinize the blood. They will actually increase the pH of the blood in order to circumvent acidosis. Usually the concentration of glucose في solution will be 2%. The sodium ion will be available in solution at 60 milli equivalent per liter. شوفوا, this is another way of expressing concentration. في عندنا الملي equivalent per liter or per ml or whatever. This is a type of concentration. We have also molarity, millimolarity. I'm sure you have encountered these units before. So this is a way to express concentration. طبعا here they are talking about sodium because sodium is very important. As I said, it goes with the glucose, so they know how much sodium they need. Okay, طبعا they are not going to add sodium as an ion. They will add it with bicarbonate or citrate along with glucose. طيب, as I told you, it can be available as ready to use liquid or as a powder for reconstitution. It's very, very important that if you want to reconstitute the powder, that you add exactly the specific amount, not more, not less. Okay, you cannot add more and you cannot add less, because if you do that شو بصير في التراكيز؟ It will change, and if they change it will not give the right effect. The isoosmolarity or the osmolarity will change, and osmolarity is very important in this case, because it can make diarrhea worse if you change the concentration. That's why you need to stick to the concentration, and that's why you should not eat and drink juices while taking the solution, oral rehydration solution, because they can change osmolarity. Okay, so you should not eat or drink when you want to take the solution, otherwise you'll spoil everything. Okay, طيب, the second solution, oral solution, is the oral colonic lavage solution. Oral colonic lavage solution. And this solution from the lavage, it's like washing. Okay, to wash the colon. Okay, so when do you want to wash the colon? Okay, you want to clean the colon, you want to wash it. Normally when you want, or the doctor is asking you to clean the colon, so the doctor can investigate your colon, the large intestine. They want to see if there is something in the colon. You have a procedure, okay, to test or to insert, for example, endoscopy to look and investigate the colon. Okay, so you need to clean the bowel. There should not be any stool or solid materials in the colon. So what do you have? The doctor might prescribe for you a balanced solution of electrolytes with polyethylene glycol. يعني polyethylene glycol اللي هو PEG. It's given طبعا PEG, there are many different PEGs with different numbers. I mean في 200, 400, 600, etc. And there is the PEG 3350. Okay, usually the pharmacist will take this, it will be in the form of a powder, and the pharmacist will reconstitute this powder اللي هو containing PEG and electrolytes. So the pharmacist, what he will do, he will take it, he will reconstitute it in a specific volume of water in order to make an isoosmotic solution. إذا الهدف why زي الأورال rehydration salt. Here you will have isoosmotic solution. الهدف من isoosmotic solution إنه when the customer or the patient drinks this solution, the net, there will not be net absorption or loss, okay, from the body, loss of electrolytes from the body, or the absorption of electrolytes from this solution into the body. It's isoosmotic, similar osmolarity with the body and the blood. So there is no net absorption or secretion of ions. That's why it's isoosmotic. Now this solution, because it contains also the electrolytes, it has a mild salty taste. طيب, is this solution, what is the volume that the patient should drink? It is large volume. It's 4 liters. Okay? So the patient needs to drink large volume of this solution. طب how can they drink 4 liters? This is a huge amount. No, actually what they're gonna do is they're gonna take it in cups. Okay, a cup is 240 ml, and every 10 minutes they will drink each 240 ml quickly every 10 minutes. Okay, so usually they will start at 6 o'clock, let's say. They will start drinking 240 ml, and usually bowel evacuation will start within 1 hour. But anyway, they start at 6 o'clock, and at mid-morning, maybe 10 o'clock, يعني after 4 hours, okay, they will be ready for doctors to investigate the bowel. Okay, فإذا this happens in 4 hours. 3 hours they will drink, they will finish all of the 4 liters, and then 1 hour they will evacuate the bowel, and they will be waiting for the doctor to see them or to see the patient. Okay, this is how it's done. في عندنا another solution which is usually given when you want or when there is a constipation, and that is magnesium citrate oral solution. Magnesium citrate oral solution. There are other names for this, such as citrate of magnesia or simply citrate. citrate معروف قصدهم magnesium citrate or citrate of magnesia. Okay, and this solution is usually clear, but it can be also slightly yellow liquid, and it's provided as effervescent liquid. So it has sweet taste, acid taste with lemon flavor. This is a nice taste to have it acidulous, like sour, with sweet taste. What is it used for? As I told you, in constipation, it accelerates defecation. That's why it's classified as saline cathartic. Okay, you see here an example. طيب, we have also another oral solution, and again this might be in the form of powder, okay, sachet, where you need to dissolve it, and it's usually effervescent. You have the sodium citrate and citric acid solution. Now this solution, شوفوا لما when you see citrate اعرفوا انه this is an alkaline. Okay, حتى هون المغنيسيوم citrate, it's an alkaline. Okay, but we are not using here as an anti-acid or something else. We are using it in order to accelerate defecation. طيب, why we are using sodium citrate? We are using it as systemic alkalinizer. Okay, طب شو يعني? Do you want to make the blood alkaline? Actually, the aim is to make the urine, okay, the urine alkaline. If you can, or if sodium citrate is absorbed into the blood, this will cause the urine, because the blood goes to the kidneys, and from kidneys sodium and sodium citrate will be excreted, so the urine will be more alkaline. طيب, when it's desirable to have urine that is more alkaline, we have certain cases, such as when uric acid, too much uric acid is causing a cystine calculi, or a crystals that will cause pain في urinary tract. So if it is alkaline, then it will dissolve these crystals. These will not form, لأنه هاي الكريستالز جاي من اليوريك acid. Okay. The same thing is when anti-gout agent that is used to treat gout. طبعا I wanted to search what do I mean by that, like probenicid. Okay, this will cause طبعا for gout اللي هو uricosuric agents, and these agents will increase the secretion of uric acid in the urine. So again, in order to prevent the crystals from happening, you usually administer with it اللي هو systemic alkalinizer, such as sodium citrate. Uricosuric agents هي agents that are used in the condition called gout. هذا example. طبعا here you will see that these are sachets, so you have to dissolve them in water. Okay, and you will realize that this is an effervescent powder. طيب, another type of solutions that are given orally اللي هي syrups. Okay, so what do we mean by syrup? طبعا you have to be careful here. Why you need to be careful? Because syrup is something general, وفي عندنا something specific اللي هو simple syrup NF, national formulary, اللي حسب United States Pharmacopoeia what is the exact concentration of the sugar and water is given. But when we say syrups can be vehicles with different concentration of sugars. Okay. طيب, syrups are concentrated, aqueous, this is very important, preparation of sugar, and when I say sugar, it's sugar يعني sucrose, or sugar substitute زي الجليسرين, sorbitol, etc., with or without flavoring agent and medicinal substances. طيب, اللي without medicinal substances بنحكي له unmedicated ايش or non-medicated syrup. اللي مع الفليفر بنحكي له flavored syrup. Okay, if it doesn't have the medicine. طبعا المedicated syrup are given orally for the purpose of the medicinal agent inside them. And what do they usually put? Usually in the syrup you have antitussive agent. Antitussive means to prevent coughing, and antihistamine. Antihistamine is for allergic conditions that can cause coughing or something else, skin conditions, nose, eyes, etc. So you give antihistamine, مضاد حساسية. Antitussive يعني مضاد كحة. So most syrups, they contain antitussive agents and antihistamines. Okay. Okay. طيب, so what are the components of medicated syrups? شو عادة بيكون بيحتوي الميديكيتد syrup? Usually it has sugar or sugar substitute, and this provide two things. One, the sweetness, which is important. Another criterion اللي هو viscosity. That's why syrup has ايش? High viscosity. Also, it may contain antimicrobial preservative because you have sugar, You have water, and this is a good medium for the growth of microorganism. It can contain flavoring agents, coloring agents, uh, stabilizing agents, solubilizing agents, thickener, etc. That is of course in addition to the drug. إذن هو عبارة عن purified water مع drug and these components, because you know that it will be given orally, so it's better be sweetened and flavored. طيب, the source of sweetness is usually sucrose, but it can be also non-sucrose based syrups, whether it's artificial, okay, artificial uh, sweetener, or maybe sorbitol or something different. Now the problem here is with sucrose, okay, and if it's given to a diabetic patient. So as a pharmacist, important counseling, you check whether your patient is diabetic or not, okay, because you cannot give this patient sucrose based syrup, otherwise this will cause ash. If you give the patient, it will cause high increase in blood sugar. You know that syrup contains a large proportion of sugar. طيب, one important thing I already talked about اللي هو simple syrup أو syrup national formulary. I talked about this. Now this one has high concentration of sugar. High. When I say high, I'm talking about 66.7 gram of sugar in 100 gram of the solution. Okay, يعني the amount of water I'm adding is less than sugar. Okay, in such concentrated sugar solutions, you may not need preservative. إذا هنا في مكتوب antimicrobial preservative, you might not need it be syrup NF. You might need it in some other types of syrups, but not in this one. Why? Because the sugar concentration is high. طب, if the sugar concentration is high, this means it's a good medium for bacteria to grow. I will tell you no. The reason is, yes, bacteria likes sugar, but it wants water. And if there is little water, all the water is with the sugar, okay, surrounding the sugar molecule, and there is nothing available for the bacteria, bacteria cannot grow because the water in the syrup is associated with sugar and it's not available for microorganism. One of the characteristics of syrup اللي هي specific gravity. Specific gravity is very similar to density. Okay, لما نحكي على density. Okay, so when you see specific gravity first, you should know that it has no units. This is very important. But I want you to imagine the specific gravity. I want you to imagine it as ايش gram per ml. I want you to imagine it like that. Again, specific gravity has no unit, but imagine it as gram per ml, which means every ml of this simple syrup or syrup NF, every ml has a weight. طيب, what is this weight? It's 1.313 gram. وهذا يعتبر one of the ways to check whether the syrup you have is having enough sugar in it or not. Okay, so each ml of the syrup has a weight of 1.313 gram. So 100 ml will have a weight of 131.3 gram. يعني if someone comes to you and he tells you, okay, this is 100 ml of syrup according to NF, I want to sell it to you, you go and weigh it. This is one of the ways to check whether the syrup has enough concentrations or not. Okay, now we're gonna talk about preparing syrups. Okay, or the preparation of syrups. I'm not talking about preparing simple syrup, only the vehicle, but it can also contain other ingredients such as the medicinal agent and other ingredients. There are different ways. In summary, طبعا I'm summarizing things. One of the way is to take all the ingredients, dissolve them in the vehicle, stir with the aid of heat. Is in here you have stirring the ingredients with the aid of heat. The other way is to stir the ingredients, يعني cause agitation, but without the use of heat. Okay, يعني simple mixing. The third way is to add sucrose to already prepared medicated liquid or flavored liquid. يعني I have medicated liquid or maybe flavored liquid not medicated, and then I add to it sucrose. This is another way. Another way اللي هو percolation. Percolation is like soaking. Okay, it's like a process of soaking, نقع, like when you extract something. Okay, so you soak it. So percolation, either you have sucrose in the percolator and you have a liquid containing, okay, percolator. I'll just draw something for you, something like that. Okay, and then what happens here, you have maybe sucrose, and then you add a solution of the medicine or medical agent. You add this solution. طبعا the solution will stay here for some time, and then you, after like let's say for 4 hours, then you allow the solution to pass. Now during this time, this is called percolation. The solution will dissolve as much as possible from sucrose, and then you will have a material or a solution containing sucrose and the medicinal agent. Otherwise, you might have not the medicine, you might have the syrup or the sugar in water, and then you add it to a percolator containing the medicinal agent. إذن يا إما medicinal agent solution I'm adding it to the percolator, أو syrup sucrose solution I'm adding it to the percolator containing the medicinal agent to extract the drug. Okay, so either way. طيب, another type of preparation, and here you need always to think about comparison between elixirs and syrups. طيب, elixirs are clear, sweetened, hydroalcoholic solutions intended for oral use. They are usually flavored to enhance palatability or taste يعني. Okay. طيب, don't forget the following. طبعا هو sweetened just as syrup, but the vehicle is always hydroalcoholic. But in the case of syrups, it's most of the time it's aqueous. We don't add alcohol. إذن most of the time we don't add إيش alcohol in syrups, although in a few cases you might have or you might see small percentage of alcohol in syrups in some products, in few products actually. Okay, إذن sweetened just as syrup, but here the sweet is much less than the case of syrup. إذن sweetness أقل. الvehicle is always hydroalcoholic, but it's rarely the case في syrup. The viscosity of the syrup is very high, but this is not the case with elixirs. The viscosity is very low. Both syrups and elixirs are for oral use. Both can be flavored. Okay. إذن في هناك some similarities and differences. which one is tastier, is better, it can mask the taste. طبعا السيرب because it has more sugar. Again, similar to syrups, it can be non-medicated when you don't have a drug in the vehicle, or it can be medicated when there is a drug. طيب إذا for the taste, no, syrups are better, of course. But for the manufacturer, or from the manufacturer point of view, they prefer elixirs because of what? One, see what is the good thing about elixirs. First, it can dissolve both water soluble and alcohol soluble components. مش زي السيربس which are only, you have usually water only. Okay? Second, the presence of alcohol, if it is more than 10 to 12%, then the elixir is self-preserved. You don't need to add any antimicrobial agent. Okay? So you have to pay attention to that. Now, in addition to hydroalcohol or water and alcohol, you might find other solvents included, such as glycerin and propylene glycol. Okay? Yes, the sugar is usually sucrose, but sorbitol, which is sweet, glycerin, or other artificial sweeteners may be added instead of sucrose. Does it contain flavoring agents? Yes, it's given orally. That's why we expect to have flavors, and for the solution to have color as well to enhance their appearance. طيب احنا حكينا في السيربس. What we said in syrups انه most preparations are antitussive ضد الكحة وانتيهستامين حساسية, right? Okay, here the examples that you might find اللي هو antihistamines للالرجيك برضه للحساسية, yes, but you will also find barbiturate, sedative and hypnotic elixirs اللي هو الفينوباربيتال. This is a weak acid, if you remember. We said phenobarbital is a weak acid in the beginning when we talked about solubility. And you have also digoxin elixir. اللي هو digoxin is known as cardiotonic glycoside. يعني it increases the grip or increases the contraction of the heart. Okay? فإذا these are the examples of ايش elixirs. Tinctures. طبعا there are external applied tinctures وفي عنا internally, but what are tinctures? And we are going to focus later on oral tinctures. Tinctures are تبو alcoholic or hydroalcoholic solutions. Okay? Prepared. It can be prepared from vegetable materials, but it can also be prepared from chemical substance. Okay, يعني it's not only the vegetable materials, but it can be from chemical substance. زي ايش؟ like iodine اللي هو الانتيسبتيك، وثايميروزال برضه هذا preservative. Okay, and they are prepared by simple solution of the substance in alcohol. What is the concentration of alcohol? It varies widely, ranging from 15 to 80%. Okay? طيب it contains alcohol, as we said, high percentage of alcohol, and this can protect against the growth of microorganisms, and not only that, but also allow alcohol soluble ingredients to stay in solution. Now, in addition to alcohol, glycerin might be added as a co-solvent. Okay? Also, because it contains a lot of alcohol, it's better, or it must be maintained or stored in a tightly stoppered container, and not exposed to excessive temperature. Why? It's because of alcohol, it's volatile. So you don't want excessive temperature, and you don't want it to evaporate or escape from the container. Also, and this is very specific vegetable materials, some of the extracted materials might undergo photochemical change. يعني upon exposure to light, okay, when it's exposed to light, the light can cause, the UV of the light can cause changes في الماتيريالز inside the tincture. هلا when we say oral tinctures, this include bergoric or concentrated tincture of opium. opium المورفين وهالشغلات هاي الاوبيوم اللي بيزرعوه. okay, طبعا you will not find such thing in the pharmacy, only in the hospital. okay, so you have opium tincture or concentrated tincture of opium. Okay, the last thing we will talk about today or in this part is administering oral liquids. So what counseling, what you should tell the patient about that. Okay, first of all, counsel the patient, tell him about the teaspoon, if it is 1 teaspoon or 5 ml. Tell him about, or tell the patient about the measurement that, or the dose that need to be taken, and preferably if there is a calibrated device as in the cap of the bottle, then it's preferred to be used. يعني if this calibrated device is available, then don't allow him to use spoons, because spoons will not give you very accurate measurement. So in this case, calibrated devices will be better. Another thing, even though the patient is taking liquid, so he can swallow the liquid, but it's better that it is followed with a glass full of water, so that anything in the mouth can be washed and goes to your GIT. If there is sucrose, then you have to be careful with regard to diabetic patients, because they can be affected by the high concentration of sucrose or sugar. Also, for medications containing alcohol, such as in the Elixir, you have to be careful when Elixir containing alcohol is taken with some drugs like metronidazole and chloropropamide, because these two drugs, they can with alcohol, these two drugs with alcohol can cause what? Can cause an anti-abuse like activity. يعني there will be a lot of problems with the person taking alcohol or Elixir containing alcohol and any of these drugs, because a lot of reactions, sensitivity, vomiting, pain, shivering, etc., a lot of bad reaction will happen. So you should be careful with that regard. The last thing is that Elixir, okay, itself contains alcohol. Okay, and you know alcohol can cause drowsiness. Okay, so if the physician is prescribing an Elixir and it's prescribing another drug that can cause drowsiness, so now you have Elixir causing drowsiness and another drug causing drowsiness, so you have to consult the physician whether this is intended, okay, or it can be replaced, Elixir can be replaced with something else that does not contain alcohol. We'll stop in this part now, and I hope you enjoyed the lecture today, and inshallah we'll see you in solutions part 3. Thank you very much. Take care.